Flight Defense, the women veterans, and women community at large to this presentation. I am wearing the teal on my scrubs because it is January is Cervical Cancer Awareness Month. And I would like to share this presentation with you all. Let me just open it up. Oh, and share. Do you see my screen? No?
Yes, I see you. I had my computer muted.
Okay. And you see my screen? Yes. Okay. You see
Yes.
my PowerPoint. I just want to make sure that my PowerPoint is on.
Yes, ma'am, I see it.
Okay, great. Okay, I just wanted to take the time to, acknowledge January as Cervical Cancer Awareness Month and share some important information with you. Like I said, welcome to Top Flight Defense, Jesse Brown VA Medical Center Women Veterans and Women Community at Large. So what is cervical cancer screening? Cervical cancer screening includes Pap tests that look for cancers and precancers in the cervix. Precancers are cell changes that can be caused by the human papilloma virus or HPV. If these are not treated, these abnormal cells could lead to cervical cancer. An HPV test looks for HPV in cervical cells. Most women 21 to 65 years old need to get Pap tests or Pap tests and HPV tests together. Not all women need to be tested every year. A Pap test is a test your doctor does to check your cervix for any cells that are not normal. The cervix is the lower part of the uterus, which opens into the vagina. Abnormal cervical cells, if not found and treated, can lead to cervical cancer. During a Pap test, your doctor puts a speculum, a tool that helps your doctor see your cervix, into your vagina and uses a special soft brush to collect cells from your cervix. The cells are sent to a laboratory for testing. Why do I need a Pap or HPV test? A Pap test can save your life. It can find cervical cancer cells early. The chance of successful treatment of cervical cancer is very high if the disease is caught early. Pap tests can also find abnormal cervical cells before they become cancer or precancers, they're called. Removing these precancers prevents cervical cancer over 95% of the time. An HPV test can give your doctor more information about the cells from your cervix. For example, if the Pap test shows abnormal cervical cells, the HPV test can show whether you have a type of HPV that causes cervical cancer. Let's see here. Sorry about this. Oops. Who should get Pap or HPV tests? Most women 21 to 65 years of age should get Pap tests as part of routine health care. Even if you are not currently sexually active, got the HPV vaccine, or have gone through menopause, you still need regular Pap tests. Gynecologists recommend women 21 to 29 years of age get a Pap test every 3 years. Women 30 to 65 have a Pap test every 3 years, or an HPV test every 5 years, or a Pap and HPV test together called co-testing every 5 years. Women older than 65 need a Pap test if they have never been tested or if they have not been tested after age 60. HPV tests are recommended for women 30 and older. Although HPV is common in women younger than 30, it usually goes away on its own in these women. Pap tests combined with HPV tests or HPV tests alone are most useful for women 30 and older. What do my results mean? Your Pap test results will say one of three things. Normal, which the cells collected from your cervix during the Pap test look like they should and do not have to do it. You do not have to do anything until your next Pap test. It could say unclear. Your doctor does not know whether the cells collected from your cervix are normal or abnormal. If results are unclear, your doctor may do more testing right away to rule out any problems, or they may have you come back in 6 months or a year for another Pap test. Sometimes not enough cells are collected, so it's inconclusive. So usually they just repeat another test. Now, if the tests come back abnormal, the cells collected from your cervix during your Pap test look abnormal. Abnormal Pap test results do not mean you have cancer. So your doctor must do other tests to find out what should happen next. Your doctor may do another Pap test right away, or if the cell changes are minor, wait 6 months or a year before doing another Pap test. If the test finds more serious changes in the cells of your cervix, your doctor will do more tests, such as a colposcopy and biopsy. Um, what is HPV or human papillomavirus? This test is the most common sexually transmitted infection, or STI, in the United States. About 80% of women will get at least one type of HPV at some point in their lifetime. It is usually spread through vaginal, oral, or anal sex. Many women don't know they have HPV because it usually has no symptoms and usually goes away on its own. Some types of HPV can cause illnesses such as genital warts or cervical cancer. There is a vaccine to help you prevent HPV. HPV is the name for a group of viruses that includes more than 100 types. More than 40 types of HPV can be passed through sexual contact. The types that infect the genital area are called genital HPV. How do you get HPV? Like I said in the previous slide, HPV is spread through vaginal, oral, or anal sex. HPV can be spread even if there are no symptoms. This means you can get HPV from someone who has no signs or symptoms and sometimes doesn't even know they have HPV. Genital touching, a man does not need to ejaculate, for HPV to spread. HPV can also be passed between women who have sex with women, or it can be passed through childbirth from a woman that has HPV to her baby. Most people with HPV do not have symptoms. This is one reason why women need regular Pap smears or Pap tests. Experts recommend that you get your first Pap test at 21. The Pap test can find changes on the cervix caused by HPV. If you're a woman between ages 30 and 65, your doctor might also do an HPV test with your Pap test every 5 years. This is a DNA test that detects most types of HPV. Another way to tell if you have HPV infection is if you have genital warts. Genital warts usually appear as small bump or group of bumps in the genital area. They can be small or large, raised or flat, or shaped like cauliflower. Doctors can usually diagnose warts by looking at the genital area. How do I get tested for HPV? If you are 21 and 29 years of old, your doctor might suggest the HPV test if you had an unusual or unclear pap test result. The test will help determine if HPV caused the abnormal cells on your cervix. Most women younger than 30 do not need HPV tests because the immune system fights off HPV within two years in 90% of cases in that age group. If you are 30 years or older, you may choose to have the HPV test along with the pap test to screen for cervical cancer. If results of both tests are normal, your chance of getting cervical cancer in the next few years is very low. Your doctor might say that you can wait up to 5 years for your next HPV screening. Preventing getting HPV. There are two ways to prevent getting HPV. One way is getting an HPV vaccine. The other way is to prevent any STIs. Or STIs is to not have sexual contact with another person or sexual contact without protection. If you do have sex, lower your risk of getting an STI with the following steps. Use condoms. Condoms are the best way to prevent STIs when you have sex. Although HPV can also happen in female and male genital areas that are not protected by condoms, research shows that condom use is linked to lower cervical cancer rates. The HPV vaccine does not replace or decrease the need to wear condoms. Make sure to put the condom on before the penis touches the vagina, mouth, anus. Also, other methods of birth control like birth control pills, shots, implants, diaphragms will not protect you from STIs. The HPV vaccine does not replace or decrease the need to wear condoms. Using condoms lower your risk of getting other types of HPV and other STIs. You can get tested. Be sure you and your partner are tested for STIs. Talk to each other about the test results before having sex. Be monogamous. Having sex with just one partner can lower your risk for STIs. After being tested for STIs, be faithful to each other. That means that you have sex only with each other and no one else. Limit your number of sex partners. Your risk of getting STIs goes up with the number of partners you have. What is the HPV vaccine? HPV vaccine helps prevent cervical cancer, genital warts, and some other rare cancers. The FDA has approved the HPV vaccine to prevent HPV-related diseases, including cervical cancer in women. Experts recommend that most people get the HPV vaccine at age 11 or 12. The HPV vaccine works best when you get it before you have any type of sexual contact with someone else. The FDA approved the HPV vaccine for people ages 9 through 45 years of age. Even if you've already had sexual contact, you can still benefit from the HPV vaccine, which can protect you from HPV types you haven't gotten yet. If you're 45 or younger and never had the HPV vaccine or did not get all of the shots, ask your doctor or nurse about getting vaccinated. When and how often you need HPV vaccine shots depends on your age and health history. Learn about the recommended doses on the CDC website. To schedule your HPV and pap test, please contact the Jessie Brown VA Women's Health Clinic. And also in our clinic, we know that there's a high percentage of women that report fear and anxiety of pelvic exams, especially women with history of trauma. Here at Jessie Brown, all of our gynecology and primary care providers are female identified and trauma informed. Here are some recommendations to reduce your fear anxiety during the exam. You could speak with the doctor if you had any discomfort or trauma in the past, and you may need accommodations like the doctor's talking through the test process. You may pause or stop the test. if you need more time or just someone to hold your hand. Um, and thank you so much for having us on the show and speaking on this. If you have any questions, Cassandra, I'm here to answer any questions.
I don't see any questions in the chat nor on my Facebook page. But what I will be doing is sending this because we're recording it and it will be uploaded onto our YouTube channel along with your slide. So if anyone have any questions, they can always rewind back up and see your last slide with the name and phone number of anyone. So
Great.
what if it's someone that's not a veteran? Call the clinic. Will the person at the clinic still be able to give them information and a phone number to for someone that they can contact?
Sure, we have several healthcare systems around Jesse Brown as well. If you are not a female veteran, we can always, give you information. There's U of I, University of Illinois Medical Center here, Stroger Hospital right across the street. Rush University is down the street as well.
Yeah,
um,
that's where I used to work, so I was waiting on that one.
Yes, so they're all very good hospitals and they take care of, people in the community and across the state. So, um, yeah, no matter where, you go, it is important for women to get cervical cancer screenings.
So and forgive me for missing that when you said it. What is the primary, well, not the primary, but what is the earliest age you suggest women to start getting tested for HPV?
Sure. So women that are under 30 years of age, most women have HPV if they've been sexually active, but because
Mhm.
we're so young, our immune, not me, not including me, I'm older, but most women between 20 and 30, their immune system is strong. So it usually goes away. The HPV clears on its own. So HPV is mostly recommended for women that are 30 and up. Um, Sometimes if you get persistent HPV and it doesn't clear, and so then the doctors do further testing, they can, if it comes back again that you're positive, then of course they'll do like colposcopies with biopsies and other testing like that. I think Cassandra, you're muted.
Yes, I was. Sorry about that. Yes, okay. Just wanted to get an idea as to what the recommended age would
Yes.
be. And I
Yeah.
did hear you state women that are sexually active with multiple partners, what they need to do in order to keep themselves healthy
Right.
from it, because we're at that age right now. We're in that stage in life where we're out there.
Yes. And
So
make sure you wear condoms or use
yes.
condoms, female condoms, male condoms.
So tell me about the female condoms. I've I haven't seen them, but I've heard about them. And at the clinic, do you all give women female condoms and male condoms?
Unfortunately, we don't have free ones to give out, but the doctors do write prescriptions for for our female veterans. Yes, and they can be delivered at home to your home address, or you can pick them up from our pharmacy. So yes, they do prescribe them.
There's a prescription for female condoms. Are
I'm
you
I'm
serious?
I'm pretty sure there is. I know our gynecologists often recommend to our female veterans patients if they would like a prescription for condoms.
Oh, wow.
Mhm.
Okay, that's good to know. Okay, well, I want to say thank you again
Thank you.
for coming on and sharing your knowledge with our subscriber and anyone that is viewing this
Yes.
channel. And I
Yes.
just said thank you so much. Happy New Year.
Happy New Year.
And I'm grateful for the partnership.
Thank you so much. We really appreciate you having us on and to get the word out about cervical cancer screening. It's very important.
All right. And oh, I have to say this. I follow us on YouTube. Just put in the word Top Flight Defense Inc. and you'll see our logo in our very first video. We're also on Facebook, Instagram, and Twitter. We're always looking for sponsors, donors, and partnership in talking about anything health and education. So, once again, I thank you for your time, patience, and your knowledge. Take care, and you have a wonderful day.